Okay, welcome to this next case. I will be providing the case prompt, and then following that, you'll have 1 minute to prepare, and then we will begin the simulation.
Mm-hmm.
So the case prompt is as follows. You are being called to manage this patient in the emergency department as the team leader. You are being called to see a 6-year-old girl that is brought into the emergency department by parents with severe chest pain that was starting this morning. She has had a cough and runny nose over the last 7 days. She looked extremely unwell after triage and was brought immediately to the resuscitation room for further management. Monitors have been applied, and you will start managing the patient once you've had some time to prepare. So you can start your preparation phase now. Okay, are you ready to proceed?
Yep.
Okay, so we'll start the resuscitation. I will be playing the role of a nurse.
Okay. Hey everyone, I was called to this room. My name's Dr. Lerner. I'll be leading. Can you tell me what's been going on?
Hi, this is Jenny. I'm one of the nurses that's here. We're just bringing her back because she looks really unwell. She's 6 years old. She has a weight of 25 kilograms that we've measured at triage. She has been coughing for the last 7 days, has had a runny nose and cough, and just looks really pale and looks really unwell. Yeah, we put on monitors and she looks like this. How should we proceed?
Okay. So can we place her on a non-rebreather? And I'd like to assess her airway now.
Okay. The area is patent. Yeah.
Okay. And breathing.
She has clear entry bilaterally.
Okay. And circulation.
She looks very pale. She feels really cool in general. Her capillary refill time is as shown as slide number 7.
Okay. Okay. So delayed cap refill. Or actually, my video. Can you play that again? My video
Yeah,
seems
of course.
to. Oh,
Uh,
yes, delayed cap refill. Sorry.
yeah, it's delayed cap refill.
Okay, and then can I get a glucose and pupils?
Yeah. Her glucose is a 5.4, and her pupils are reactive uh, overall. Her eyes
Okay.
are closed, so GCS is 14.
14. Okay. And any other signs on exposure?
She's moving her four limbs, no other rashes, no other abnormalities you can see on exposure.
Okay. So everyone, this is Jenny. She's 25 kilos. She is in right now uh, presumed septic shock. She seems to be presenting with cold shock. So do we have IV access at this moment?
No, I can obtain IV access if you want.
Okay. Yeah, if we could get two large bore IVs.
Okay.
And then I'd like to give her a 20 cc per kilo bolus of normal saline,
Okay. I've got two IVs.
500 mils.
You want me to draw
Okay.
some blood work as well too?
Yes, please. If you could send off a CBC, CRP, gas, lactate, urea, creatinine, liver function. and a blood culture.
Okay.
Perfect.
All right. Those will all be sent. I can work on that.
Okay. And if we could also call X-ray in the meantime as well, just to get ready on standby.
Looks like the patient is looking more unwell at this point.
Okay.
So
And just going back to my assessment of the patient, do we have a pulse?
you do not have a pulse.
Okay. Everyone, we're in cardiac arrest. Can I get somebody on the chest to start compressions, please?
Okay. So initial chest compressions are on slide number 8. So we're starting chest compressions.
Perfect. Okay, can I get a CPR board attached to the patient? Can I get for compressions, we're doing 15 compressions to 2 breaths because we have more
Please
than
look at the
one
compressions that
people.
are given at slide
Oh,
8.
sorry. Um, okay, so I can see your compressions. Can I get you to please compress at a faster rate, um, allowing for recoil in between? So I want you to compress at a rate of 100 to 120 compression beats per minute. And then we'll be doing 15 compressions to 2 breaths.
So these are your new compressions now.
Okay, perfect. So improved. Great job, guys. Um, and so as I said, can we get the CPR board and can we get pads attached as well?
Sure.
Those are our number one priorities.
Please attach the pads on slide 10 and show me where you're going to attach them.
Perfect. And so, uh, I have attached it to the patient.
Yep. Perfect.
Oh, click the machine.
Okay. All right. Okay. So you can continue to manage the patient or defibrillate as you want. If you want to continue, go
Okay.
back to slide 2 or go continue with the defibrillation at this point.
Okay. I'd like to do a rhythm and pulse check. And so this patient appears to be in VFib. And so I'd like to go ahead with a shock.
Okay.
Oh,
Uh,
yep. And so I'm going to move my, um,
okay.
hmm.
We'll put that
Okay,
on.
perfect. Thank you for, yeah. And we're going to shock at an energy of 2 joules per kilo. So if we could go up to 50 joules. And
Okay.
can we continue compressions while we charge? Okay, and
Uh,
so we'll charge
Charging
now.
time. Okay. So charging. All right. So charge is done.
Okay, charge is done. Okay, so please stop compressions. I'm clear. Are people clear off the chest?
Yes.
Is oxygen clear?
Yep.
Okay, deliver shock and resume compressions.
Okay. Uh, Please proceed back to slide 1.
Okay, perfect. So we've given one shock uh, for a VFib, pulseless VFib. At this time, can I please get 0.25 milligrams of IV epinephrine? And we will do another rhythm check in 2 minutes. Rhythm and pulse check.
Can you repeat that order for epinephrine, please?
Yeah, so 0.25 milligrams
Yep. What concentration?
of the zero point 0.1 milligram per kilogram. Sorry, 1.1 milligram per mil concentration. Um, and can we please, can you drop multiple doses?
Okay.
But we're just going to give one right now.
Okay. All right. Do you want me to deliver that now?
Yes, please.
Okay. Epinephrine is being delivered 0.1 milligram per milliliter at 0.25 milligrams. So dose is delivered.
Okay. And can you please let me know when we've reached um, 2 minutes for the rhythm and pulse check? And we will be giving the epi every 4 minutes. So
Should we be
every
giving
second.
uh, Should we be bagging this patient as well too?
Yes, yes. Okay, if we could start, I believe we are bagging with uh, 2 breaths for every 15
Okay.
compressions. Um, did we have any of our blood work back?
No blood work is back at this point.
Okay. And do I have someone available to be ready to secure the airway?
Someone from the code team will be coming down shortly.
Okay,
There's no issues with
perfect.
bagging the patient at this point.
Okay, great. And as far as compressions, how is our quality of
Uh,
compressions at the moment?
Continues as shown on the screen.
Okay. And team, with the next rhythm and pulse check, if we can have compressors switch.
So 2 minutes are up at this point.
Okay, perfect. So I'm going to go back to my defib machine. And
Okay.
so off the chest, can we please check the pulse? Do we have a pulse?
No pulse.
No pulse. Okay. We if you can continue compressions, we're gonna defib at 100 joules, so 4 joules
Okay.
per kilo.
Yep.
Okay, we'll charge.
Charge.
Okay. And team, please stop compressions. I'm clear. You're clear. Oxygen's clear. Deliver shock
Okay. Shock is delivered.
and resume compressions.
Perfect.
And
That's
I'm
all
assuming my rhythm is what I'm seeing on the monitor.
correct. Yep.
Yeah. Yeah. Perfect. Okay, and we're continuing CPR. And can I give another 500 cc bolus of normal saline, please?
Okay. Your CPR providers have switched as you have requested, and
Hmm.
I can get a bolus of normal saline given. So you want 500?
Yes, please.
Okay.
Okay, everyone, just to summarize where we are, we're in pulseless VFib. We have delivered 2 shocks. We have given 1 dose of epinephrine, and we are continuing compressions at this time. We are we're bagging easily. Does anybody have any suggestions or any recommendations?
I think we should think about our five H's and T's. And the epinephrine dose could be updosed. I think are we aiming for the 1 in 10,000 or the old nomenclature, 1 in 10,000 or 1 in 1,000 concentration for epinephrine?
I believe we're with the 1 in 10,000.
Oh, actually, okay, yeah, you're correct. Sorry, I apologize. Okay, we can
Um,
have the epinephrine if we need to.
okay, perfect. We can give that. And as far as our H's and T's, we are currently bagging when it comes to hypoxia. Um, we don't have, do we have any of our blood work back?
Uh, there is no blood work back. No.
Okay, and we've had a normal glucose. We can recheck that though.
Yep, I can recheck it. Glucose is 5.3.
Okay, and can we get a repeat temperature, please?
Repeat temperature, uh, they are 35 degrees right now.
35 degrees. Okay. Um, and then can I also, as far as, are we able to get a gas?
I can try and get a gas. It's hard to get blood flow at this point.
Okay. And do we have any evidence of any tension pneumothorax or cardiac tamponade?
When you auscultate, you hear good air entry bilaterally. No midline shift.
Okay.
2 minutes is.
Um, one thing we can do empirically is to give some calcium gluconate.
Mhm.
And
2 minutes is up at this point. Should we give another epinephrine now or not?
so at this point, let's do a rhythm and pulse check, please.
Okay. No pulse. Rhythm is
No
unchanged.
pulse. Okay, continue compressions. And so we will charge at 6 joules per kilo.
Should we give another epinephrine?
Yes, please go ahead with the epinephrine. Thank you.
So I'm going to be delivering another epinephrine. It's um, 0.25 milligrams of 0.1 milligram per milliliter. I'll deliver that now at this point.
Perfect. And can we please charge to 6 joules per kilo for this patient?
Looks like there's a bit of a rhythm change on the monitor.
Okay. Okay. I'm seeing normal sinus rhythm on our monitors. Let's get a ECG to confirm that.
Okay, I'll look at getting an ECG.
And do we have a pulse?
Uh, you're still giving CPR right now.
Okay. So can we do a rhythm and pulse check, please?
Okay. Um, you can see the rhythm as shown, and there is a weak pulse.
Pulse. Okay. So we will pause compressions. Um, let's give another 20 per kilo bolus,
Okay.
and let's start a high dose epinephrine infusion at zero point 0.1 megs.
And then you want an epi infusion?
Yes, please.
Uh, sorry, zero point 0.1. What is it? Can you repeat that again?
Uh, micrograms
Yep.
per kilo
Yep.
um, per. I can't remember if it's minutes or hours. I will
Okay,
look
I
that
can
up.
look it up. Yeah, I can look
Yep,
it up.
perfect. Um, and also, can I get this patient started on some high flow?
Yep.
And if we could attach a bear hugger
Okay,
to warm the patient.
sure. All right. So ICU has now arrived. They will take over the care of this patient at this point.
Perfect.
Yeah. All right.